Good morning, everyone. Welcome to today's update. I'm Chancellor Donde Plowman. I know this has been a week of uncertainty for many, and I hope that you are all taking care of yourselves, getting sleep, connecting with friends and loved ones, and spending some time in this nice, beautiful, crisp fall weather. As always, we are here to talk about COVID, and I have with me Dr. Greg and Provost Zomchik. We're going to go over the latest numbers. Once again, talk about planning for students' departure from campus, and then we'll discuss a little bit about the end to the academic term. So let's start with the data update. As of yesterday, we had 65 active COVID-19 cases. 58 of them are students and 7 are employees. This total includes 16 new recoveries. So those are recoveries we took out. There were 8 new active cases reported yesterday. So again, those two lines continue to kind of map on each other. We now have in quarantine or isolation a total of 374 people. Of that, 317 are students. So you can see that line has been sort of level for the last few weeks after coming down from a high. Really, the highest point was on September 13th, 14th, 15th, it looked like. So looking at our community testing, let's talk about that for a minute. Last week, if you look at the top row, we were in Stokely, Hess, Kappa-Sig House, the Whitehall, and we also did makeup tests. So last week we collected 974 samples from residents in those locations, and we had about 73% participation. So we're continuing to hit higher percentages on the participation. Of course, we'd love that to be 100%, but we're getting it at the levels that make us confident in what we're learning. So now if you look at that chart, what it tells you is that people contributed their saliva, which was examined in pools, and each pool here was typically 3 or 4 individuals. So we had a total of 317 pools from those 974 samples. We found in those 317, there were 16 pools that had a positive, at least one case of the virus. So that meant we had 53 individuals who were referred for diagnostic testing. If you're following, I'm reading from left to right on that chart. And out of those 53, we had 9 positive diagnostic tests. That's of the tests we've received to date. Okay, so that continues to be a low positivity rate, which we see as a good sign. But let's talk to the expert. I don't need to talk about it. Let's talk to Dr. Greg. Dr. Greg, what are you and your team seeing in the data this week? What are those numbers telling you?
Well, good morning, Chancellor. It's good to be with you again. Happy Big Orange Friday.
Yeah.
Well, we continue to be pleased with how the data is playing out on campus. Our number of daily active cases is holding steady at less than 100, and our new cases at less than 25. Active self-isolations are higher than we'd like, but as we've noted before, that really comes down to the percentage of individuals who are being identified as close contacts, which is generally staying around 40 to 50%. We'd certainly like to see that a little bit lower. With the CDC's updated definition of a close contact, less than 6 feet for more than 15 minutes cumulatively over a 24-hour period, staying mindful of keeping your distance is especially important if you want to avoid having to quarantine. And thankfully, we've identified no new clusters, indicating that group gatherings, which can be a driver of clusters, appears to be less of an issue now, and we definitely want to see that continue.
Okay, great. That's really helpful. Let's think for a minute, talk a little bit about how we're keeping a close eye on how our case trends around broader, how they compare to the trends around the broader Knoxville community in the state. We see numbers going up. Can you talk about what you're seeing there in the community, in the state, and what are the potential impacts of that for our campus community?
Well, you're right. Across the state and specifically in the Knoxville community, cumulative case counts per day, including growth rates, are increasing. New COVID cases per 100,000 population are rising, and the positivity rate remains high between 10 to 15%. These numbers indicate persistent community spread of infection. And since the campus lies in the middle of the community, these numbers indicate that despite our lower campus numbers, we remain at significant risk to see an increase in our case counts as well. Fortunately, hospitalizations and deaths in the student age population remain low, and they're not as great as in the broader community at large, but it's important to remember that COVID is potentially a deadly infection, and patients in the student age range are not immune from having to be hospitalized and even death related to it. So avoiding infection is still the safest approach when it comes to COVID.
Okay. Switching gears here, we're about a month and a half into our community testing strategy. What have we learned, and how is it what are those efforts going to look like going forward?
Well, as we previously discussed, we were concerned that as more testing was performed, we might actually see a significant increase in our numbers, but we haven't. Students have done an awesome job of involvement with our testing efforts, and with that, we've still seen a general leveling off of both active and new cases this week as well as the past several weeks, and that's great news. As we've been looking at the direction that we'd like to take our community testing strategy, it's clear that increasing our testing frequency would be most helpful. At this time, our plans for the spring semester will include more frequent testing. We hope to be able to test all on-campus residents at least weekly, and even open our saliva testing program to off-campus residents as well. We're still in the planning stages, so hopefully we'll know more soon and we'll keep you updated.
Thank you very much. Can we switch gears and talk about end of semester? We talked some last week about preparing for winter break, which comes right around Thanksgiving, and steps that our students can take to protect their loved ones as they return home. I want to revisit this for anyone who missed it last week or who may still have questions. So as everyone knows, our students leave campus the week of Thanksgiving, and we'll be finishing the semester and final exams remotely. I know we have a lot of parents and family members of students who watch these updates. And Dr. Greg, would you, well, first of all, let me say to the parents, I want to ask you to help me, Dr. Greg, others, by urging your students to get tested. There's no cost to it. We want them to get tested. Dr. Greg, let me just ask you. So we're encouraging, like I just said, all students to get tested before they return home. Why, again, is this important? And how should students go about getting this test?
Well, Chancellor, some of our students may be returning to smaller communities where resources for care are somewhat limited. Many will be coming in contact with family members and friends who successfully navigated avoidance of infection to this time, but may be at significant risk of complications or even death should they become infected. We want to keep these communities and individuals safe. So being tested and finding out that although you may not have symptoms, you are indeed infected would impact your travel plans to protect those communities, families, and friends. The testing is available at the Student Health Center. We have nasal swab PCR testing that can be performed on site with a turnaround time of 24 to 48 hours. An appointment is needed for that testing, so students would need to call the Student Health Center at 974-5080 to schedule that an appointment for that testing. We also have the Everlywell COVID home collection kits available. They have a turnaround time of about 72 hours. No appointment is necessary to be issued one of these kits for home testing. They just need to come by the Student Health Center to pick one up. There's some paperwork involved, so it'll take a few minutes of their time. Both are available at no direct cost. We'd really like to see everybody take advantage of this testing capability before they leave. And the Everlywell COVID home collection kits are also available for employees.
So I just want to follow up there. So even a student that, let's say they're in the dorm that's getting tested this week or next week in the pooled saliva, somebody might think, well, I just did the pooled saliva. I didn't have to go for further testing. Why would I go then in the following week just before I go home to get the PCR test? I know you've got a great answer to that.
We know, first of all, our pooled saliva test only gives us an idea of who may or may not be infected. We can't make a diagnostic decision off of that. But second of all, even if we were able to make a diagnostic decision based on the saliva test, just because you're negative on one day doesn't mean that you're not going to be positive the next. So really the benefit of getting tested is to determine if you're positive on the day that you're tested.
Okay. So when is the best time for students to get tested?
Well, you don't want to wait to the last minute, but you also don't want to get tested too soon. Sometime at the start of your last week on campus would be ideal. That way you have time to get your results back before you leave. Again, the average turnaround time on results is 1 to 3 days, depending on which test you have performed. We obviously anticipate a greater demand for testing toward the end of the last week of classes. So getting tested earlier in your last week could reduce your wait time and increase the likelihood of scheduling a time that's most convenient for you to get tested. You'll still need to complete a self-isolation form after you've been tested, and then isolate until your results are known. After submitting a self-isolation form, a contact tracer will reach out to you to determine a plan of action that's safe and best suits your particular needs.
What should students do once they've received a result?
If you've completed the self-isolation form and then test positive, let the contact tracing team know. They'll help you with your isolation planning. If you're an on-campus resident needing isolation housing, that'll remain available and they can assist you in arranging that. If you're positive and didn't complete a self-isolation form, do so at that time. The self-isolation form is the means whereby our contact tracers know that you'll need some assistance. They can't help you if they don't know. If you test negative and are not a close contact with someone that's been diagnosed with COVID, you'll no longer need to self-isolate, but you'll need to be extremely cautious from that point forward. Monitor yourself closely for development of symptoms. If you begin to feel ill, get tested again. Otherwise, continue to strictly adhere to health and safety guidance to avoid exposure and to avoid exposing others, just in case your result was a false negative or had not yet turned positive. Remember to wash your hands often, avoid close contact with others, cover your mouth and nose with a mask when you're around others, cover your coughs and sneezes, clean and disinfect frequently, and stay away from others as much as possible, especially groups of people. Also, if you've not gotten a flu shot, what are you waiting for? Go get one. They're readily available on campus at the Student Health Center Pharmacy and other healthcare resources throughout the community. We also have another flu vaccine event planned for Thursday, the 12th of November from 9 to 4 at the Student Union Ballroom. So there's plenty of opportunities to get a flu shot.
Make your plan to get a flu shot. Very good. Okay, so we will be increasing the amounts of testing in the residence halls next semester. And we will be providing more information in the weeks to come. It will become a regular part of everybody's life in the spring semester when we return. Frequent testing is what allows us to keep our community safe and provide experiences for our students. Finally, we are preparing for socially distant commencement ceremonies before Thanksgiving. That's a weird time. Before Thanksgiving for our fall graduates and also for our spring and summer 2020 graduates. So now we've got Provost Dr. John Zomchik, who is going to share with us a little bit about this. So Provost Zomchik, welcome. Our teams are busy planning commencement ceremonies. You and I have been in meetings to talk about it so that we can celebrate our graduates. Can you talk about the planning for those ceremonies?
Yes, Chancellor, I can. Thank you. And hello, everyone. So far we have 10 ceremonies scheduled, 2 each on Thursday and Friday, November 19th and 20th, 3 each on Saturday and Sunday, November 21st and 22nd. Each ceremony will have approximately 200 graduates, including, as you mentioned, some who graduated last spring or summer and are returning to Rocky Top to celebrate their accomplishments. We're really excited about this. So each graduate, we started by allotting each graduate 4 guest tickets, but we're currently offering some extra guest tickets at some of the ceremonies as capacity allows. So check in with us if you think you might need some more guest tickets, and we'll let you know if we've got room to accommodate your guests. So as you say, it will be a little different this commencement. We'll have music and a speaker. We'll have the pomp and circumstance, but it won't be exactly the same as it was before the pandemic. But I think we have a really good ceremony planned for everyone. And at two of the ceremonies, we're also going to feature commissioning of the ROTC graduate cadets, which is one of my favorite events. But for me, really the best part is that the names of each graduate will be called, and each graduate will be able to cross the stage to be recognized for his or her achievement. I think our staff's done a really great job working within the limitations brought on by the pandemic, while still creating a meaningful and unique commencement experience for our volunteer family chancellor.
I'm looking forward to all 10 of those services. You and I are going to be busy those 4 days. So as a reminder, one more question. We have resources available to help our students related to commencement. And can you touch on those? What are those? What are we talking about?
Yeah, that's a great reminder. So, by the end of today, there'll be 12 class days left in fall semester. I want to put on my coaching hat for a moment, not my literal one, but my figurative coaching hat, and tell all our students to dig deep and finish strong. But remember, you don't have to do it all on your own. We've got resources for you. You'll find them listed on studentsuccess.utk.edu. I know you've got it in you. And I also know that as volunteers, we can help one another. So when I say go Vols right now, I'm shouting out to all our students as the semester gets closer to its end, to reach out to your fellow students, to work as teams, to find the best within you and really finish strong during this semester. We have every confidence that you can do it. Thanks, Chancellor.
Okay, great. Well, it's going to be great events. Everyone will be wearing masks, and this will be the year that we all showed up in pictures with masks, and our graduates will be in cap and gowns and masks, but we'll be doing it in person, and we're very excited about that. So that really kind of concludes today. That's all we have for today. I know you all remember that the Vols football team will take on Arkansas tomorrow evening. They're traveling to Arkansas. As always, let's cheer on the team safely and responsibly as we are excited about that event. But please remember to be safe. Let's don't do anything that would get us sick before the end of the semester. So thanks to everyone for joining us, and we will see you back here same time next week. Go Vols.